If you're turning 65 soon, there's something that you haven't considered. And the reason I know that is because most beneficiaries that we're talking to, the thing that they're going to miss is something we call IRMAA. IRMAA is very important to understand because it can affect how much you're going to spend on your Medicare, I guess, journey, package, whatever you want to call it. It's certainly going to affect your budget and how much you're going to spend on the products that you need. Now, to get us started on what IRMAA is, because that's what I'm going to talk about for the next few moments, I gotta tell you what this means. It literally means income related monthly adjustment amount. Income related monthly adjustment amount. And this is just a term we use that describes what your Part B premium for Medicare could be, because all health insurance products are going to have some kind of premium, which means what you're going to pay monthly in order to be enrolled into that plan, and Medicare is no different. Now, to back us up a little bit and start from the beginning, a lot of people come in thinking that Medicare is going to be completely free, and that's hardly the case. Most times, our beneficiaries that we help are going to pay some kind of premium for Medicare. Now, you do hear about $0 plans. Those are Medicare Advantage plans, and I'm not going to talk about those in these next few moments. We have videos on our page that you can watch talking about Medicare Advantage and what you could spend on those. However, I want to talk about the premiums you could spend for just original Medicare. Now, before I jump into all this information, I do want to remind you that you can follow the information in the description of the video below so that you can talk to one of our agents about your specific scenario. I only have about 8 minutes with you in this video, so if you want to know specifically your situation, we have agents that would love to talk to you right away to let you know what Medicare is going to cost you. But IRMAA plays a big part in this, especially when you start putting packages together with all these different products that you need. This is something you want to have under wraps so you understand what you're getting into. I want you to think of a chart, and I'm not going to go over the chart in this video because we do have access to that, and again, we want you to talk to an agent about that. But I want you to think of this chart that has different income levels, and then out next to it, it has what your premiums could be. That's really what IRMAA is at its simplest form. It's a chart, if you will, that says, oh, your income is this, so your Part B premium can be this. But let's back up even further than that. When it comes to Medicare premium, as long as you've worked 40 or more quarters, which comes out to 10 plus years, then Part A, your hospital coverage, is going to cost you $0 a month. Now, I still don't use the word free. That's not free, it's a $0 premium. The reason I don't say free is because you pay taxes your whole working career. As long as you've been paying your taxes, then you paid for your Part A premium. If you did not pay taxes, then you can pay for Part A. That can cost you more. Again, as long as you or your spouse has worked 10 or more years, you will get Part A for $0 because you've already paid for it. So that's good news. Now, when it comes to Part B, because Medicare is made up of Part A and Part B, we actually have for 2026 a $202.90 premium for Part B. So Part A is going to cost you $0 as long as you've worked, you met the requirements. Part B is going to cost you $202.90. That is stock. That is where it starts. Everybody will have at least a $202.90 premium for Part B. And you may know somebody that tells you, well, I don't pay for Part B. Well, the most common situation there is that people don't realize they're paying it because it comes out of Social Security before the check ever hits the account. Now, there are some people who actually do not pay for Part B, but that's because they have Medicaid, and Medicaid's paying that premium for them. Technically, their premium is still $202.90, but Medicaid is paying it for them. So if you don't have Medicaid, at the very least, your Part B premium will be $202.90. And since we now have that settled, what this can cost us, now we can talk about our first point here, which is Part B. The most common thing that's going to happen if IRMAA is going to affect you is that your Part B premium will go up. The stock level is $202.90, but the top level actually can be up to $700 a month that you could be spending for Part B. And right away you can do your math. That's a $500 increase. That's $6,000 a year that you could be spending on Part B of Medicare. So it's something you certainly need to understand. Now, don't worry if you're, I can count on one hand, I can count on one finger how many customers and beneficiaries I've helped that have that top level premium. It's not very common. Your income would have to be very, very, very high. It would have to be very, very high for that to be at that top level. It doesn't happen a lot, but where a lot of beneficiaries get caught is maybe that second level, that second tier. It's an extra $80 a month or so that you could be spending in premium that you need to be aware of, especially when you're building your packages. Because let's talk for a moment. When you talk to an agent about what your Medicare is going to look like, if you decide you want to go Medicare Supplement and that's the direction you want to go, well, we're starting at $202.90. Well, then I have to get a drug plan. And that drug plan is going to cost us somewhere around $35 a month. And then I have to get a Medicare Supplement. And that's going to cost me somewhere around $220 a month. Well, I'm looking at spending a lot already. Imagine another $80 on top of that that you weren't prepared for. So when you start budgeting these things, it's very important you know what you're getting into, right? So it's going to affect your Part B premium. That's the first thing for sure. After that, my second point here is that it can also affect what you're going to spend on your drug plan. Your IRMAA can affect that as well. The average drug plan right now is actually about $36 a month is what it is nationally. I put 35 for easy math, but it is about $36 a month right now. That could actually be affected by IRMAA, and you would pay the stock premium plus whatever you would have to pay on top of that. Again, there's a chart that shows these things, and we have access to those charts. I don't like to talk about it in the video. I would love for you to reach out to one of our agents. You can follow the information in the description of the video below, and you can talk to one of our agents today to make sure that all your budgets are going to match up and that IRMAA is not going to affect you too much. Or maybe it is, and you need to be aware of that. There's really nothing we can do about IRMAA and your income-related monthly adjustment amount. That's something that's just going to happen depending on where you are, but you certainly want to be aware of where you sit. So it can affect your Part B. It can affect your drug plan costs. So those are things that you need to be aware of. But my third point is this: income and assets. You know, I mentioned earlier, there's not much that I can do, but I can help a little bit. So what people don't realize is that this says income related, but this is income and assets potentially. It's any kind of profitable gains that you make on anything. So where a lot of beneficiaries get in trouble, especially when they're retiring, is maybe their income is still under that level for that Part B premium to go up. Maybe they're still in that tier 1 category, but they have a 401k or they have a 403b or they have an IRA that they end up taking money out of, or that they move into something that is not tax deferred. And so now they end up having capital gains on that investment, and what happens is that it bumps them to that next level. And they could have avoided that. Maybe they rolled that over into something else, or they did something that they weren't going to end up paying taxes on it, whatever. There are ways to avoid going to that next level when it comes to your assets, your retirement accounts. Those are things that you need to consider. It's not just going to be your income. It's anything that has capital gains. Maybe you're selling a house. Maybe you have property, whatever it is. If you end up having capital gains, that would go towards your IRMAA increase. And that's something that you need to be aware of so that you don't get caught, making a decision that you wouldn't know is going to affect your premium and cost you a lot of money. And a strategy we like to use specifically is if somebody's got a lot of assets, maybe they have a retirement, let's say a 401k, that's the most common one. They have a 401k and they want to move that over, or they want to roll it over. They may wait 2 years to roll it into something that makes them money, or they take money out of initially, so that they don't have to worry about the IRMAA going up, because 2 years from now, your income is certainly changed, and now your income is going to be lower on what they look at, because they look at 2 years worth of income when it comes to your IRMAA. Now you can make a little money on those assets, you can have some capital gains, and it will not bump you up. All I'm trying to say is that there are some strategies that we can help you with to keep these lower. But what's most important is that you're aware of this. And many agents are not teaching their beneficiaries about IRMAA. We are, because we know that it's very important that you have the right budget and the right coverage for you and your family. So again, follow the information in the description of the video below so that you can talk to one of our agents today that can get you a budget that is good for you and your family. Listen, Medicare is a journey. We're a compass. Use it.